Hey guys, welcome to Podiatry Practice Mastery. Don here. What I want to talk today is about, I got some feedback from this course that I did on plantar fasciitis. So I've did this course. If you guys haven't downloaded it, you can go to drpelto.com/heal and you can kind of see what it's like. This is made in Kajabi. That's that website that I use. And it's kind of a rendition or a culmination. So once again, things don't always start easy. I want to explain this. So don't kind of compare what others are doing, just kind of do it. So what I initially did is I made like these ebooks, and those were like really laborious. I had someone edit it. It was a kind of a pain in the butt to do, but I did it. And then it turned into videos. So I take the same the patient presentation, those slides, put them in the book. Then I made them into videos, which was a little bit easier. And but a lot of these videos were long. Like it was like 10, 15, 20, 30, and really to explain everything about plantar fasciitis took me 40 minutes or an hour in some of these webinars. So I put it into this little kind of bite-sized thing. I call it a 14-day plantar fasciitis course, or call it a home study course. Basically, it's something I give to patients when they come in the first visit, because I usually see them 14 days after. So I'll see them at the 2-week point. And I got some feedback, and it's nice because you can, when patients are going through it, there's places that they can comment. And this is very similar to what I did with the 30-day practice blueprint. And in that, people are kind of responding, so I can fix things, I can make it better, I can see what resonates with people. And within the practice blueprint, the thing that the patients like the most is something that I called a treatment evaluator. Basically, I take all of the treatments, not all the treatments, but the ones that I do mostly for plantar fasciitis, and I put them in terms of what's most effective and least effective. Because we all know that like icing isn't as effective as a cortisone, and or like anti-inflammatories aren't as effective as a cortisone. So I kind of put it as like least effective, most effective, and based on kind of how they're treated. And this is the thing that resonated most with what I'm getting back from the patients, is they like that. They like to assess how the evaluation is. So I'm thinking about adding it to the actual presentation, because when I show them that checklist, it kind of overwhelms people because there's so many treatments in there. But if I could take that whole checklist and put it into this, like what's most effective and least effective, then you can pick the things that are most effective first, right? And then on there, you can also include the things that are most effective. For example, like a shockwave or amnio or orthotics or things like that. And you can share, like, orthotics are more effective than an over-the-counter insert. But there's a greater price to that. So that was something that was interesting. So I'm trying to add that to the other presentations, but as I'm digressing here, as I was talking about in these courses, I've found doing a course like infinitely easier than writing a book. And so you may want to consider that. I use this thing, if you go to my resources section on Podiatry Practice Mastery, you can see Kajabi. That's where I use to make the course, and you can use other things. I've done one on Thinkific before, which is another course creation. You can as easily just do like a one web page and put a number of put like day 1, day 2, day 3. I've seen something as easy as that, and just divide it into different sections and send it out to patients in an email format. But what I find is with doing the courses, you just record a video and you share your screen and you give them great content and you divide it up. So patients, they get it like one step at a time versus like getting overwhelmed with things. So, and you also can have interaction because they can comment, and then you can ask for like referrals, ask them to send friends, and give them other. It's kind of really robust, but something you might want to consider. And so, what's my entrepreneurial mind thinking of? Well, this course that I give away, and I'm not selling it. It's pretty cool. It's good benefit. So there are a couple of things that I'm thinking about. Well, how can I get it into more people's hands? So I'm thinking about, there's this really good over-the-counter insert that I like. It's called Walk Hero. It's on Amazon, and they sell millions and millions of these. And I'm thinking, well, could I potentially do a joint venture with them? Meaning, like, after someone gets this and they're getting it for plantar fasciitis, they could get my free course, because I want to build my email list. And then in there, within that course, you could even have like an ad for their plan. It costs $14. It's super cheap. but it's the best one I found over the counter on Amazon. And and I could put a little ad on there for them as a kind of a whatever. A kick, we could an agreement between it. So patients, I'm sending them there anyway. But then they could also send this course out to all of their patients that are buying this thing. So that was one thought of how to kind of multiply this course to others. This is course number 1. Now my struggle with this course is the course is super fun to make. Like I made the course, and I would like making like 20 courses. That's what I typically do. Is I make like 20 courses. Or all the time. But what I need to do now is figure out how to distribute this course to others, not just my patients, but how I can get it bigger and distribute it out and give it out. It's funny, you make something, but you just can't even give the darn thing away. So that's what I'm trying to figure out. If you guys have any ideas, let me know. Okay. And once again, if you haven't done that 30-day practice blueprint, you can get that at Podiatry Practice Mastery under the resources section. It talks about a lot of these ideas, not all these, but these are kind of newer ones, but some of the basics. Okay, guys, have a good day.